When I first reached out, it was around the time that COVID broke.
Yeah,
And I was
yeah,
like, look, we gotta educate our people. How are we gonna look post COVID? And
absolutely.
I reached out to you, Raj, and you put the brakes on me earlier. Like, I can't talk yet, B. I can't talk yet because we're rolling it out, and this is my position as such.
Yeah, yeah,
And really, what I wanted then we're gonna get from you today was really, how does this change our people? How does this change our society?
absolutely.
How does this change the practice of medicine? How does this change our community? And there's a lot that we're still trying to figure out. Like, I don't know what you can answer, what you can't, but let me just throw one across the board. Based on what you're seeing in autopsies, what have we learned about COVID that we didn't know 2 months ago?
And it's good that we're having this conversation now versus 2 months ago, because 2 months ago I would have told you I don't know.
Mm.
2 months ago, when the first death that we've had in this city was back in March 20th. And for your listeners, I'm here in Washington, D.C., and I would not have been able to tell you much. I would have been like, yo, we're still trying to figure it out. And quite frankly, the smartest people around are still trying to figure this thing out.
Mm.
But I will tell you that this is affecting primarily those individuals. And can we break it down? I don't want to call it black people, right? Because the reality of it is that the simple gene that melanates our skin doesn't put us at risk for health disparities like hypertension and diabetes,
That's right.
and doesn't put us at risk for COVID. The mere fact that we have melanin does not put us at risk. What puts us at risk is the history of slavery, right? What puts us at risk is the fact that we have endured 400 years of slavery and now find ourselves in a post-slavery environment where we're still feeling the results of the lack of equity that came out of the slave process, right? And what does that mean? That means a lack of access to education, economics, housing, healthcare, and criminal justice practices. And so when we're talking about COVID and COVID related deaths, we're talking about, and I won't get too down in the weeds until you ask me, but we're talking about a state that happens within our aging population, right? There's this kind of baseline inflammation that happens with aging, and we will all have a hyper inflamed state when we're older, right? And the best thing we could do is to work on that now, right? Eat
Mm.
well, exercise, try to keep our bodies and our cells as young as possible. But at the end of the day, if we have a high inflammatory or pro-inflammatory state, this COVID virus will cause more inflammation in our bodies, and then our bodily response is what we call a hyperinflammatory response. And that's what leads to the pneumonia. That's what leads to the lung disease. That's what leads to the heart disease. That what leads to the prothrombotic state, which we have clots in our bodies. All of the things that we're learning on TV is because particular parts of our community have not have had access to healthy things, and we have poor health outcomes to begin with. So I don't know if that makes sense,
It makes
but
all the sense.
that's functionally where we are and why we're affected the way we're affected.
Are poor communities across the board getting that same response, negative outcomes via COVID?
Right. So poverty is one aspect, right?
Mm-hmm.
So because if this country wasn't so racist, then poverty would be the common denominator,
Mm-hmm.
right? But because there's such institutional racism, you could be rich and still not have seen a doctor in 6 years
Right.
because of the
Shoot, inherent
this
distrust.
notion, this distrust, right? The
Mm-hmm.
Tuskegee experiment, the things that are pervasive in our community that keeps us from accessing care, makes us sick and rich.